Hello everyone. So as we all know कि only 4 months are left for upcoming INICET exam. So today we'll discuss the strategy for the same. तो देखते ही देखते अभी नीट पीजी का रिजल्ट आया था. काउंसलिंग इज स्टिल गोइंग ऑन. प्रीवियस आईनीसेट की काउंसलिंग इज आल्सो स्टिल गोइंग ऑन एंड वी हैव द नेक्स्ट एग्जाम कमिंग अप. तो यही इंपॉर्टेंट चीज़ है समझने के लिए कि अगर इफ़ यू डिडंट गेट अ गुड रैंक इन अ पर्टिकुलर एग्जाम, जस्ट डोंट वेट, just don't lose a lot of time. Start preparing because next exam comes almost immediately. Now, as far as what I've said earlier, INICET is a better exam to prepare if you are confident enough that you can get a seat, because the predictability is very very good here, because exam date generally won't change. One thing. Another thing is कि previous year questions and previous year topics keep on repeating, so you can predict the exam by doing the previous year questions as well. So now, without wasting further time, we'll discuss the strategy that you should be using in these 4 months. The first thing is, uh, most of you must have at least read your notes once and prepared it well. Now, starting from the second revision, I would recommend कि take 2 months for your second revision, because second revision is the most crucial part. उस point पे you will start understanding things. You will start making your 20th copy. So this is the most important time. Take time to revise your notes. Keep a separate copy with you and add volatile things in that, so that your 20th copy will also be prepared at the same time. Along with that, try to practice previous year questions of INICET, NEET and FMG all. आई रियली रिकमेंड कि आप आई सेट के साथ साथ नीट पीजी एंड एफएमजी के भी प्रीवियस ईयर क्वेश्चंस करो, बिकॉज प्रीवियस ईयर क्वेश्चंस ऑफ एनी पर्टिकुलर एग्जाम इज डेफिनेटली इंपॉर्टेंट. तो जब भी कोई भी पर्टिकुलर एग्जामिनर क्वेश्चन बनाता है, तो ही जनरली टेक्स प्रीवियस ईयर क्वेश्चंस ऑफ आई सेट, बट सम एग्जामिनर ऑल्सो टेक्स प्रीवियस ईयर क्वेश्चंस ऑफ नीट एंड एफएमजी. So try to do that. Along with that, try to solve GTs every weekly or every 10th day. Now, in these 2 months of your particular revision, you have to revise, you have to make your 20th copy, you have to practice your PYQs, and you have to give GTs. After these 2 months, you will be left with 2 months. You can divide those 2 months into 1 month each, and you have to revise. Now, two revisions of 1 month each. Along with that, you have to revise your 20th copy daily. So try to keep things simple. बहुत सारे लोगों को ऐसा लगता है कि जिन लोगों की रैंक आती है, दे डू इट इन अ वेरी कॉम्प्लिकेटेड वे, बट ट्रस्ट मी, दे डू इट इन द सिंपलेस्ट वे पॉसिबल. Just revise your notes, make a 20th copy so that volatile parts will be covered. Revise that, do previous year questions and do GTs. Nothing else needs to be done. Just follow this routine and you will definitely going to succeed. तो इन चीज़ों में यू कांट लूज एनीथिंग. यू हैव टू रिवाइज योर 20th कॉपी सो दैट योर वॉलेटाइल थिंग्स वुड बी कवर्ड. अगर आपने 20th कॉपी नहीं भी बनाई है, यू कैन जस्ट हाईलाइट द वॉलेटाइल थिंग्स इन योर नोट्स सो दैट यू कैन रिवाइज इट एंड you can just focus on the volatile parts while revising. You have to give GTs. Now, coming to GTs, you have to give GTs smartly. You have to revise your weaker subjects, or you can revise your 20th copy just before giving GTs, and you can discuss the GTs after the result with your friends, or you can just revise it by yourself, so that you will come to know about your weaker subjects, about your weaker topics, and about your strengths. So, to keep it simple, and for this INICET is concerned, you have to focus more on the first and second year subjects. Apart from it, you have to focus more on the short subjects, as well as on subjects like medicine का एक part है infectious disease. So since AIMS has its own department of infectious disease, there are more chances of questions coming from the infections. Since AIMS is a pioneer institute for oncology, there is more chances of questions coming from the cancers, more and more questions on cancer. You have to focus on these part. Along with it, since the HMPV virus is a new hot topic, so you have to know in and out about the HMPV virus also. So try to keep things simple, focus on the basics, and you will definitely succeed. All the best.